Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. We're here at Mercy Hospital, one of the most beautiful hospitals with a beautiful view. Not today because the day is cloudy, but they have the sea and they have the bay, and that is so beautiful. I imagine how much it means to the patients to be able to see the beautiful bay. And with me is Dr. Angel Sanchez Artiles, and he's the Associate Medical Director for Catholic Hospice. And Catholic Hospice, Dr. Artiles, I told you, is so dear to my heart because my mom was ill before she passed, like for 6 months. So they were family to me. They were family, always there, present, the service. It was just amazing the way they helped me, the way they guided me to what was going to happen. So, doctor, tell me your role, how you started, and just a little bit about yourself.
Thank you. So yes, I started with Catholic Palliative Care Services back in 2021. I completed an internal medicine residency here in Boca Raton in Florida Atlantic University. Then I did a fellowship in hospice and palliative medicine at University of Miami. Straight out of fellowship, I came to work with Catholic Palliative Care, and I became a part of the team here at Mercy Hospital, providing inpatient palliative care. And after being with Catholic Palliative Care for about a year and a half, I stepped into the position of the Associate Medical Director for Catholic Hospice in Miami-Dade.
Miami-Dade County. Well,
Correct.
congrats to you.
Thank you.
And I know that there's a lot because everybody's living more. So as we have more people that are living up to the 90s, there's a lot. Like my mother-in-law lived 97, and my
Absolutely.
father-in-law also 97. So basically, there's a lot of demand.
Yes.
So tell me about that.
Yes, it is. It's true. And unfortunately, a lot of the patients are not receiving the benefits of palliative care and hospice as early as we would like. And it has a lot to do with education that needs to be provided to the
Right.
physicians, to the families. There's a lot of misconceptions and a lot of myths regarding
And yeah,
this.
a lot of people don't know about palliative care.
Right.
So tell me a little bit about that so the people that are listening to us have an idea. Because I, for one, didn't have an idea that before you really get into the real hospice, there's a period of time where you're not hospice quality or whatever you want to say it. Maybe I'm not using the right terminology, but basically that you need help.
Correct.
Your loved one needs help, and it's not really at the hospice level, but they do need to be seen. That's what you call palliative?
Correct. So palliative care is a specialized care for patients that are living with a serious illness. So palliative care is appropriate for patients at any age and any stage of the disease when they're facing an increased symptom burden and the stress of the serious illness, whatever the diagnosis. Palliative care has a goal of improving quality of life for patients, but also for the family. And we do this by impeccable assessment of symptoms and management of their psychological, their social, their religious, existential distress. So it's a holistic approach to care.
Right, and do you also mental health?
Yes.
Because I'm thinking that at that point in time, maybe they need some mental health too.
Absolutely. And
Support.
patients and families receive counseling, they receive support regarding grief, and there's bereavement services for patients.
Right, talk about bereavement services. I
Yes.
remember that word, bereavement services.
When patients are seen by the palliative care team, it's an interdisciplinary team. So there's the doctor, there's the nurse, the social worker, the chaplain, and then they have a lot of sessions and support groups to help them face this serious illness. And then once they're under hospice, there's bereavement from the day of admission all the way until 13 months after the patients expire. And there's support groups and bereavement camps. We have Camp Aaron for children and teenagers, and they go to talk about the loss of a loved one and talk about grief and talk about death.
Oh, okay, I didn't know that.
that's
Oh,
one of
so
the
you have that.
examples.
So basically, doctor, you're very busy.
Yes,
Right,
absolutely.
to say the least.
Yes.
After everything that you said to me, no, you know what? People don't think about it, but in reality, it's a lot of work that Catholic Hospice does because it's all these stages that people go through and the support, and you take people, the family, by their hands to support them and let them know that it's just part of life. But there's always, you feel that, and I went through that. It's bad, but you have so much support, so much love, so much help that it helps you go through. I remember the lady that used to help us in Catholic Hospice saying, you have to go during the day, you go out, you do whatever you have to do, then you come back. We're handling your mother. You'll be fine. We'll let you know when you have to stay. So they pushed me. I remember they said, no, come on, go with your father, go have lunch, go out, be out for 3 hours, and then come back.
Yeah.
And that is so important. You need that because if not, you feel guilty.
Exactly.
Right? Talk about the guilt.
Yeah.
Right?
So
You don't wanna
the
leave.
goal of palliative care and of hospice is to provide an extra layer of support. And in the case of palliative care, it's given along with curative treatment. So for example, a patient that has cancer going to their chemo, they're suffering from all the side effects from the treatment and the
course,
disease
of
itself.
course.
So we're here to guide the patient within the disease process. Where are you and what does the trajectory look like? And when is it time, if it's time, to talk about hospice? Which is a type of palliative care for patients that are considered terminally ill.
Terminally ill.
Which means that they have a prognosis of expected 6 months or less. if the disease runs a natural course.
And I just have an interesting question. Have you ever had someone who's in hospice that eventually, for whatever reason, God saves them and they have to be discharged? That's the word, discharged from hospice?
Absolutely. So
Wow.
a landmark study showed that patients receiving palliative care along with curative treatments actually lived a little longer, like 2.7 months, with better quality of life, improved mood, less hospitalizations. So in hospice, some patients have actually lived longer as well, and their functional status, cognitive, nutritional status has improved. If that's the case, and the hospice cannot demonstrate that the patient is declining,
Wow.
they get discharged from hospice. They graduate from hospice.
That must be amazing.
Yeah.
For you doctors to see that. That's a moment of happiness, right?
And it just shows that it's not only, the benefit was not actually created for patients in the last days of life. The advantage should be early on, and that's the importance of early hospice referrals.
Okay, well, wow, that's wonderful. Thank you. Did I leave anything out that you wanted to emphasize here to the
No, I
public?
just wanted to highlight that Catholic Hospice belongs to a bigger entity, which is Catholic Health
Right,
Services,
Services.
and it's a ministry of the Archdiocese of Miami.
Yes.
Catholic Hospice has been around for 35 years, serving patients and families, and we've done this wherever the patient calls home. So it could be a home, but it could be an assisted living, a nursing home, and we have inpatient units as well for patients that have need aggressive symptom management.
Wonderful. Thank you, Dr. Sanchez
Thank you.
Artiles. Thank you so much for being on A Business Minute with Lily Lopez, and we'll see you all next week.
Thank you so
at the
much.
same time. Thank you.